Well, this is a bookend that I'm installing onto the beginning of a video where I discuss an infection in my legs. Now, it's still very much a presence, and it is a disabling thing for me, but it was also something that I discovered that I had best deal with in my own way. And securing the antibiotics was the first step. However, I did, on the advice of the doctor, check in as an inpatient at the Toronto Western Hospital, part of the University Health Network. But that did not work out well, and after 2 days, I discharged myself. I didn't tell them to get lost, but I told them what I thought about their professionalism or lack of thereof. What's going on? Well, here are my feet. And as you can see, after a few months of mania, they're not doing very well. Now, what causes this? This is caused by sodium Divalproex, valproic acid, whatever you want to call it, but I've never seen this level of damage to my feet before. What happens is your body, your kidneys start to fail under epival. So you always have some water retention tending to be on the feet. But this time, the water retention was so severe that the feet couldn't handle it. Whenever I would bump into something, they would open up. And these things, you know, they're bizarre. They're just like, it is bursting out and it has become quite infected. Therefore, I must do something about it. Now, the procedure is as follows. The first order of business is to use saline solution to irrigate the area, which is what I'm going to do now. You just pour it on. And there we go. Use saline solution. You can make your own saline solution with salt and water. But you got to get it in there. And not much. And you can see my skin here is also in need of rejuvenation, and my toes are showing signs of stress too. So all of that gets dealt with, right? Now, the next thing that I do, now I've never done this before, is, excuse me, I take a cloth. I should probably clean this cloth before I use it, so I'll do that now. It really doesn't have to be clean. This is not a sterile area. So now I'm just going to wipe down the area. Just to expose it. Now, the pharmacist said you have to go to see your doctor on Tuesday. You have to deal with this immediately. Now, I've been debating going down to the CAMH, the Center for Addictions and Mental Health, because this is a problem induced by epival, or sodium divalproex, or whatever you want to call it. That's what this is caused by. Okay, here we go.
Now basically I'm going to have to do this 2 or 3 times a day. And I was told that I would have to put a dressing on it. But that's not my style. I don't put dressings on stuff like this. I like them to breathe in the free air. Now you can see I'm rubbing the area and I'm already stimulating the skin. As in, it doesn't really hurt either, but I can feel it. But you can see that the inflammation is already starting to kind of go away. It's as if the body is receiving instructions from me by wiping to essentially remove the toxins, which is what I wanted to do. There is a tip that I can give you. Lysol spray. It's not an antibiotic, which I need to be on to fix this problem, but it's a mighty good sterilizing agent. That's Lysol. Doesn't matter what kind of Lysol you choose to use. They all work in about the same way as far as the body is concerned. And if you really want to know, it was a product developed for gynecological health. So women used Lysol to keep themselves fresh and clean in that area. So I could just say, okay, I'm going to treat this with Lysol. And it might do a lot to alleviate the problem, but I can't take the chance. But you can see I'm stimulating the area. What I am doing now is I'm inviting the body to take back those toxins, to take the infection and to deal with it more aggressively. But that's about it. See, I'm not getting very far over here. So, but I took a lot of grime and dirt off of the wound, which is important to do. Now the next step is to spray with an antiseptic. That's what this is here. And that's what we're going to do. And I'm putting this all over the place. Letting it really sink in. And there, nice and wet. And I especially spray heavily into this injury here, which is a bit of a puzzle. I mean, how does an injury like that happen? Well, the pressure in the feet is so great that it seeks a least point of resistance, in this case here, in this case there. So I'm using this liberally. And that should do it. Now the last thing that I'm going to do is apply a medication that is general purpose polysporin. Now, the antiseptic has just gone on. Now it's time to coat the areas affected with polysporin. And this is the strongest polysporin they make. And on Tuesday, when I visit my doctor, or a doctor, I shall get antibiotics. But until then, that's what happens here. That's what happens here. And most assuredly, that's what happens here. So, I can use a bit here too. And that, in a nutshell, is how I'm treating this injury that's caused by sodium divalproex, valproic acid, epival, whatever you want to call it. It doesn't matter. The one consequence of taking divalproex is it is awfully hard on your kidneys. Now, when your kidneys are under attack, and they will be when you're on divalproex, you really, I don't know what to do about it, quite frankly, because divalproex is my last line of medication. So I'm just going to let it sit there. I'm not going to put any coverings on these wounds. I'm going to let the polysporin sink into the wound. And that hopefully will give me some relief. You know, things may be better by Monday, which is 2 days from now, but I somehow doubt it. But what I'm doing now is a stopgap measure. I don't want to lose my feet for obvious reasons, but I should warn you that the feet really take a beating even under normal circumstances on divalproex. You will notice that your feet are constantly swelling up. What to do about it? Well, you can elevate your feet and perhaps the fluids will return to your body, but chances are the best thing you can do is massage the fluid out of the foot, and that's forceful. You really have to know what you're doing in order to do this, but it's possible. This is uric acid that you're dealing with. The other option is you can take a needle and remove the fluid. Believe me, your body will be very happy to have that fluid gone because it doesn't have anything to do with it. It's basically saying, we got to store this somewhere, and so they put it in your feet. That's where it tends to end up because your feet are the lowest point in generally speaking, when you're sitting or standing. Everything flows to the feet. So that's your lesson for today, and I dare say a caution. Discuss this with your psychiatrist, discuss it with your medical practitioner, because this type of injury caused by a medication is what's known as iatrogenic, and what that means is it's an unanticipated consequence of a medication that you've been given. So this is the worst case of unintended consequences I have encountered, and hopefully the last time that I encounter it. Goodbye, folks. Discuss this with your psychiatrist, discuss it with your medical practitioner, because this type of injury caused by a medication is what's known as iatrogenic. And what that means is it's an unanticipated consequence of a medication that you've been given. So this is the worst case of unintended consequences I have encountered, and hopefully the last time that I encounter it. Goodbye.